In my mind, there is never one single best way to treat a patient.
Once it's been determined what type of tumor your pet has, you can begin to discuss treatment options with your veterinarian. If the tests show that the tumor is benign or non-cancerous, your veterinarian may recommend that the tumor be left alone and monitored. Some pets develop many benign tumors as they grow older. You can create a tumor map to record the location and size of benign tumors, so you can easily monitor them for changes and identify new tumors that should be brought to your veterinarian's attention. If the tumor is malignant or cancerous, your veterinarian will discuss your pet's treatment options with you.
So we sent the biopsy away to the pathology laboratory, but the results came back as a malignant basal cell tumor. The difference between malignant and benign is that benign.
When Dr. Mazza told me that my cat had cancer, I almost wasn't listening to him anymore. And I had to go home and kind of take it in and sleep on it and look at the cat and say, okay, now I'm ready to fight. But it took me about 24 hours to get to that point.
Once you find out that your pet does have cancer, I'd say that the next thing is to not panic and realize that for the vast majority of types of cancer, there are treatment options that are available.
When your pet has been diagnosed with cancer, I think you need to take the time necessary to make a decision and to make the appropriate decision for you and your pet.
There are a number of ways to treat cancer, including surgery to remove the tumor, chemotherapy, and radiation therapy. Sometimes combinations of these therapies offer the best chance for success. Which options are suitable for your pet will depend on the type of cancer, the size and location of the tumor, whether it has spread, and your pet's overall health. As your pet's guardian, your own personal feelings will also factor into the decision. These can be very hard decisions. However, your veterinarian is there to help guide you through the process.
There isn't a right or wrong answer. There really isn't. Our ultimate goal is always quality of life, maintaining quality of life. And if we're not doing that, we're not doing our jobs. And we need to regroup and decide, okay, what do we need to do?
If you decide not to pursue treatment for your pet's cancer, you can ask your veterinarian about palliative options for managing the signs of cancer, with therapies such as pain medications and nutritional support.
Sometimes just palliative care, supportive care. Not necessarily killing the cancer or trying to slow its progression, but just minimizing side effects. Doing things like appetite stimulants, or if they're in any kind of pain, providing pain medications and things like that, just to help the pet feel as comfortable as possible for as long as possible.
If you decide you want to treat your pet's cancer, it's best to determine from the start the extent of treatment you wish to pursue.
Unfortunately, oftentimes a decision is made not to treat a patient that has cancer. And we may be seeing them initially where there's a lump or bump, but it's not causing any problems. They're not painful. It's not impacting their life. So it seems less critical to maybe move forward at that time point. But unfortunately, what can happen and what that we see on a regular basis is that the tumor does progress. It does grow. And maybe now when the decision is made to do something about it, it may be too late.
Once you have considered your pet's treatment options, it's time for you and your veterinarian to determine your pet's treatment plan. Some treatments can be performed by your pet's primary veterinarian. There are times when your pet may benefit from going to a veterinary specialist. Depending on the type of cancer, this may include a surgeon, a medical oncologist, or a radiation oncologist. Specialists receive several years of in-depth training and have access to advanced diagnostic testing and therapies. Specialists often work in university hospitals and referral practices where they work as a team to optimize your pet's treatment.
The owner may only meet with 1 or 2 veterinarians, but their pet will probably be evaluated by at least anywhere from 3 to 5 different doctors over the course, and we all work together.
This team approach allows combinational therapies, such as coordinated surgery and radiation treatment. Advanced treatment plans such as these can significantly improve your pet's treatment outcome. If you decide referral is right for you, your veterinarian can help you make arrangements for your pet to see an oncologist and send copies of the medical records to the referral center. Be assured, your veterinarian will remain a vital part of your pet's healthcare team. Your pet's oncologist will communicate closely with your veterinarian, and after treatment, your veterinarian can help manage your pet's follow-up care.